So as we debug the stubborn weight, we talked about energy, we talked about sleep, we talked about digestion, we talked about cravings, we talked about stress. Now we're going to talk about pain. Pain can really trigger the adrenals to pump out more cortisol. So pain inflammation can stop people from sleeping and losing weight. So there's a couple different things we need to know about that. We have three types of pain. One is pain that's referred. So let's say, for example, the person had no known injury, yet they have right shoulder pain. Then we know it's coming from the gallbladder. So gallbladder will create bloatedness over the right rib cage, underneath the right rib cage, the right shoulder, neck, headaches, this whole side right here. It can go into the hand, it can go right down here. And then the heart will cause pain in the mid-back, right about the mid-back part. That could be heart, an overworking heart, or the left side through here. Okay, left shoulder or arm, that's heart. So again, if they have angina or chest pain, we need to know that. Okay, the digestive system down here can create a lot of neck tension, a lot of headaches, a lot of rubbery neck, and they go to the chiropractor 1,000 times and never gets rid of it because the source is being referred. So we really want to look at, is there a reason for the pain, or is it just coming from somewhere else? Very few people look at this, and this is not how they taught us in school. Sacroiliac joint pain, left to right, could be the ovary. Lower back pain could be uterus from a huge, heavy period, or prostate problems referred back. So that's very, very common. And then you have pain that actually occurs from an injury, or you have chronic pain after an injury. Then we're going to just do the acupressure on the opposite side. Unless it's on the knee or the ankle, we'll do the opposite side, but we'll do the proximal muscle, the one that is a little higher up. Okay? So that's how we kind of clear that out. For referral pain, we get to the source. We do acupressure in the gallbladder. We give them nutrition for the gallbladder. But then you also have systemic pain. That's like pain all over. That's called fibromyalgia. That's a simple thing because they're losing cortisol. Cortisol is an anti-inflammatory. So they end up with fibromyalgia, rheumatoid arthritis, a lot of digestive Crohn's and inflammation in the colon. And that protocol you would want to do adrenal. Okay? Okay, so then we have inflammation. We talked about pain, now inflammation. I'm trying to summarize the most common cause of these things. If you have joint pain, that's adrenal, that's a cortisol problem. If it's gut, it could also be adrenal, but it could also be an imbalance in your flora. Then you need a probiotic. It could be a damaged lining of the gut called leaky gut. That's glutamate is what they need. You can do cabbage juice. Or did you know that all the grass-fed products, beef, grass-fed cheese, grass-fed kefir, yogurt, that type of thing, has the glutamate in it? That's pretty cool. Cod liver oil is great for the gut to repair it, but you could also have inflammation from fiber and food reactions. The lung, asthma, is an inflammatory condition. Sinus is an inflammatory condition. If it's seasonal, then do vitamin A from the cod liver oil, vitamin D. Sometimes you need bile, gallbladder formula, because they're not absorbing it. And then all year round, that's that fungus among us. It's biofilms, we talked about that. Xylitol, garlic flesh, sea salt, nasal rinse, that will actually handle it. And then we got all the itises, bursitis, tendinitis, arthritis. These people need to mobilize calcium by increasing fat-soluble vitamins, D, K2, cod liver oil, to metabolize that calcium. If the person has headaches, the most likely is the gallbladder problem. Then the second one could be the neck from the digestive system, or just the misalignment from a car accident, whatever. Or sinus could cause it. I mean, you want to be able to think more broadly and not just treat the head with an aspirin. Find the root cause, because it could be menstrual related, because if it's cyclic, it could be estrogen problems, because the estrogen affects the vascular system. It could be an old injury to the head. So I always ask people, have you ever had any head injuries? They go, oh my gosh, I had 4 concussions. I've been hit over the head with a steel pipe. Well, hello, we just need to fix that old injury in the skull. Or it could be other causes, and that could be maybe you have a tumor in the brain. If you've exhausted these, then send them out for a CAT scan. But the thing is that why start with the CAT scan when these are the most likely causes? When you find the root problem, it's always obvious. Okay? That's just a tip. All right, so that's the pain protocol.